comes later will be very welcome too. So good afternoon, everyone, and a warm welcome to the second presentation of our new SIPHER webinar series. I'm Petra Meyer, SIPHER Consulting Director and Professor of Public Health at the University of Glasgow. Over the past 5 years, we've used our SIPHER UKPRP funding to bring together policy and academic experts with practice partners in Scottish Government, Public Health Scotland, Greater Manchester Combined Authority and Sheffield City Council. We use innovative systems science approaches to transform public health and well-being and tackle inequalities. This webinar series of short lunchtime talks will offer you the opportunity to hear directly from our team about this exciting work. Each short 20 to 25-minute presentation will have an audience question and answer session, and a full recording will be available on the SIPHER website after the event. To submit questions, please use the Zoom Q&A box, and we'll come to these at the end of the presentation. So without further ado, I'm delighted to introduce our speaker, Dr. Hugh Rice. Hugh is a SIPHER researcher and postdoctoral research fellow in the School of Geography at the University of Leeds, working on developing key data infrastructures and policy microsimulation models. Our policy partners identified a gap around high-quality local data, which they need to inform policy design and to address inequality. In this webinar, you will introduce you to the SIPHER Inclusive Economy Datasets, which aim to address the scarcity of such data. Our set of indicators capture economic inclusion and its enablers, as well as health and well-being at local authority and ward levels. Please feel free to submit questions anytime via the question and answer tab. You've got the floor.
Thanks. I will share my screen. Can everyone see the slides? Is that okay?
Yep.
Okay, good. Thanks to Petra for the introduction and to everyone at SIPHER for making this happen, so Alison and Helen and everyone else, and welcome to everyone joining us online. I'm Hugh, I'm a postdoc at Leeds. I've been with SIPHER since 2022, and to begin with a bit of scene setting, research in this area has shown that people living in more inclusive economies tend to experience less deprivation and better health and reduced health inequalities. So equitable access to services and opportunities is at the forefront of policy planning at local and national levels. And SIPHER's responded to this by developing our two inclusive economy data sets. So they're at local authority level and ward level to support those working in this area to be able to make better, more informed policy decisions. So today I'll talk about three aspects of the data sets very broadly: what they are, how we created them, although hopefully not without too much technical detail, and how you can use them. And that will include a range of supplementary resources and web visualizations, for example, that we've developed to help you explore the data at your leisure. So yes, if you have any questions, please submit them in the chat and I'll answer as many as I can at the end. So very quick summary of what I'll talk about. Firstly, I'll give an overview of both data sets because there's some common elements to them. I'll then move on to the specifics of each because they were developed separately, although we did attempt to use as similar as possible metrics in both cases. And then I'll review some impact and outputs, so where the data sets have been used up to now and or will be used in the near future. So first, an overview. This is really a little bit more housekeeping. What do we mean by an inclusive economy? So we're interested in the relationship between the extent and nature of inclusion and how that produces health and well-being outcomes. And just to be pedantic, we're concerned with the concept of economic inclusion rather than the competing concept of inclusive growth in the literature. And again, to be just very pedantic, when we talk about Great Britain rather than the UK, that's simply because some of the data were not available for Northern Ireland. So it kind of highlights the challenges involved in sort of data-driven research like this. little bit more housekeeping. So our motivation in developing these data sets were that they be meaningful to decision makers and that they capture some recognizable relevant aspect of inclusion. And we'd like to produce a data set with enough indicators that they capture the concept of inclusive economy, but not too large that they're difficult to they're too complex. And also we always think about the possibility of updating the data set in future, so we have to think about the updatability. And wherever possible, and wherever corresponding closely to the specification in the technical report on which both data sets are based, we used external non-synthetic data sources where we could, and for the indicators where that wasn't possible, we used the SIPHER synthetic dataset for the ward level dataset, which I'll talk about more later. And lastly, for our overview, here is a very brief overview of the indicators. And again, we've tried not to spend too much time on technical detail here, but for example, we have indicator 1B. So the concept behind it is skills and qualifications, and it's in the wide outcomes and enablers category. So we've got two categories, and the specific metric we used for that is the rate of, or the proportion of 20 to 49-year-olds, so adults, with NVQ2 equivalent qualifications or better. And for context, that corresponds to 5 GCSEs above, I think, a C, something like that. And for all the indicators, that's the pattern that we followed. So we've got a concept and then a specific metric that which is intended to capture that concept, but quantitatively. And there are several supplementary health and well-being indicators that are present in the two data sets which differ, but this is just the core inclusive economy indicators which are common to both. But I'll talk about all of those later. And there's a link to the technical report there at the bottom. So onto our specific section on the local authority level data set. Excuse me. Here we've got two figures, two visualizations of a cluster solution that we computed. So this is a grouping of similar local authorities in some sense, which I'll talk about in a bit more detail. The labels that we've attached are on the left, so less inclusive, more inclusive, average, which kind of covers everything else, and a mix of extremes. And this is called a k-means clustering, so it's a machine learning tool. And the algorithm allocates each item, which in this case is local authorities, to one of k clusters, and you can say what value you define what value k is, so you can have any number of clusters. But statistically, this was the best cluster, and the local authorities are assigned to a cluster based on the similarity between the indicator values, effectively. So this is just this is kind of a way of looking at similar local authorities, and both figures show the same data, but the figure on the left is a visualization that you can produce with one of our web tools, whereas the figure on the right is a hexagon map where each local authority is scaled according to the size of its population. So it just gives it's a different way of looking at the same data, and in the hexagon map, it's easier to perceive the differences between the clusters because they're often grouped geographically, and most obviously London, which falls mostly into the extremes cluster, which is a mix of some very positive values for the indicators and some more negative values. So, and this is the same data again, just shown in a different way. So this is an analysis that my colleague Andreas did, who I hope is here, on the relationship between the inclusive economy indicators and the life expectancy and lifespan variation of local authorities in each cluster. And again, on the right, we have local authorities are the data points. Each is coloured by the cluster value according to life expectancy and lifespan variation, which are calculated from age-specific mortality rates. And so here, the life expectancy can be seen as an average population health indicator, whereas the lifespan variation is a health inequality indicator. So ideally, we'd like to see high life expectancy and low lifespan variation, which would suggest less inequality with respect to mortality. And so perhaps the best two clusters to compare here are clusters 1 and 2, which are the less inclusive and more inclusive clusters, which are top left and bottom right. So cluster 1 has lower life expectancy and higher lifespan variation, whereas cluster 2 is the other way around. And it's really interesting also to look at cluster 4, which is, we've labelled a mix of extremes, which, as I say, is mainly London, which has a strange combination of higher life expectancy, but also higher lifespan variation. So there's greater inequality than cluster 2, which is the more inclusive one. So these are just different ways to visualize the data. So we move on to some specifics of the ward level data set now. And although it was developed separately from the local authority level data set, we did try to use the same metrics where possible. And for almost all the indicators that was possible, but for a couple it wasn't. So the big difference between the ward level data set and the local authority level one is that in the ward level, we used the SIPHER synthetic population for several indicators. So 8 of the inclusive economy indicators and the SF12, which is the short form 12 wellbeing, self-reported wellbeing measure, which we used as indicators as well. So the SIPHER synthetic population is a digital twin of the GB population, and its power is in the breadth of variables that are available through the Understanding Society survey on which it's based, and they cover many aspects of people's daily lives, which we can leverage in a piece of research like this. And using the synthetic population allowed us to produce many indicators, as I say, for which data weren't available at ward level, because ward level is a much smaller spatial scale than local authorities. So the smaller the scale, quite often the scarcer the data becomes. So although this is a topic by itself, please get in touch with me or my colleague Andreas or Kashif if you'd like any more information about the synthetic population. I'll very quickly talk about it. So it's derived from the Understanding Society Longitudinal Survey, or UK HLS, and it's constrained by this set of variables, so age, sex, qualification, and so on. And when we say constraints, we mean that the characteristics of the synthetic population were constrained such that they matched exactly the known values of these statistics. So the sex ratio, for example, the age distribution, and so on in that list of constraints in the synthpop exactly matches the known statistics for each area, which in this case is the lower super output areas and data zones in England and Wales and Scotland, which we then aggregated to ward level for our data set. And the synthetic population is presented when you download it as the box in blue on the left. So a set of area codes, which are the LSOAs or data zones, and a set of individuals, which are duplicated because the pool from which they're drawn is much smaller than the actual population of the UK, or GB in this case. And in order to produce a rich database, as we have for this data set, but for whatever your application is, you can merge it firstly with the individual data or with the household level data, depending on what your application is. So here are some examples of visualizations that you can produce. Having created our data set from synthetic and other sources, we can produce area profiles like this. So these are some visualizations of 2 city regions in order to show the degree of variation amongst wards, so within larger areas, whether that be local authority or in this case city regions, or in the case of South Yorkshire, a combined authority, which includes Rotherham, Sheffield, Doncaster, and so on. And these are just intended as examples of what users can do with the data and what kind of visualizations you can produce. So on the left, we have housing affordability, and there's a really big range of values for South Yorkshire CA. And on the right is the physical component score, PCS, of the SF12 wellbeing measure, which again comes from the synthetic population. for females in the Glasgow city region. Again, there's quite a lot of variation, so that's quite a significant variation in wellbeing score. And some more visualizations here. So another piece of validation work that we did for the ward level data set was to compare our results with the indices of multiple deprivation. So the IMD is a set of indicator data sets that are released at intervals at several years, and they're generally done separately for each of the 4 nations, and they're divided into multiple domains, which are kind of analogous to indicators in our case, such as employment and education. I mean, they're actually aggregations of indicators, but we'll say indicators for the purpose of these slides. So we've aggregated the IMD data and our ward level data set to 4 regions, and I've split England into London and the southeast and the rest of England, because they were quite different. And each data point on each plot is a ward, so there's 8,000 of those, and they're ranked by numerical value, and then the black lines are just best fit, linear best fits, so you can get an idea of how good the correlation is, which are generally quite good. So the top figure shows indicator 1A, which is participation in paid employment versus the IMD employment domain. And the lower figure is indicator 1B, which is skills and qualifications versus the IMD education domain. So the point is that the correlation is quite good. So it gives us some confidence that the data set is doing what it's supposed to do, but without duplicating the IMD domains. And I should make very clear that the metrics are the metrics used in each case are very different. And lastly, for this validation section, which is again just a set of examples of visualizations that you can produce, we took both of the SIPHER datasets at local authority and ward level, and we aggregated them using a population weighted means up to regional level. So these are the, let's see, is it 11 regions of GB? So I hope you can see the region names at the top, but it starts with northeast at the top left and goes through to Wales at the bottom right. I think they're ordered not alphabetically, which is a bit confusing, but they're ordered by code, I think. And so each subplot is a region, and the blue and the red points are the local authority. Blue and the red are local authority and ward level data for 3 years, which are the common years between the 2 data sets. And so if the agreement were good, we'd expect the lines to overlap or be very close, which is the case for the first set, because we used exactly the same metric and the same data, I think, for the first one. However, and this is kind of an illustration of the complexities that we in obtaining high quality data at such small scales. For the second example, which is poverty, the agreement isn't as good, and this is because we used slightly different metrics. So for one data set, so I should take a step back. The metric for poverty is the proportion of children living in low-income households. For one data set, we used a measure of poverty after housing costs, which is AHC, and for the other data set, we used before housing costs, which is BHC, simply because the data in the same format were not available at both levels. But it's interesting that the trends are very similar, even if the numerical values aren't. But they serve the same purpose in terms of indicators. And so, last section, the impacts and outputs of the work so far. So I'll quickly review how the data has been used, and I'll talk you through the different resources that are available. And we've produced a huge amount of resources that you can use to download and look at the data. But firstly, some publications and other research that have been produced as a result of the data. So this is a paper in BMJ Open led by my colleague Andreas. So we used the local authority data set, and we found that over 50% of the variation in quail at local authority level can be explained by the indicators. And quail in this context is quality adjusted life expectancy. And if the indicators were correlated as we'd expect to quail, we'd like the red points to be to the left of the line and the blue points to be to the right of the line, which is true in about half of the indicators. but not true in the other half. So I think Andreas suspects there's some degree of residual confounding involved. But again, please get in touch with me or Andreas if you'd like more information on that piece of work. And secondly, this is hot off the press from my colleague Rob, who successfully defended his PhD thesis last week. Rob used the ward level data set, excuse me, to identify characteristics of some subgroups that saw limited health benefit for some real and proposed energy interventions in Greater Manchester. Oh, excuse me. And several groups were identified to perform poorly under existing strategy, including areas with high child and energy poverty and high labour market exclusion. And so that covers 3 of our indicators. So poverty, energy poverty, and labour market exclusion. And so in this context, QALY is a measure of the impact of a policy intervention, and it stands for quality adjusted life years gained or lost according to an intervention being applied. And to be clear, this is a map of Greater Manchester, and the difference in quality, the relative difference in QALYs is relative to a situation where a particular intervention isn't applied and when it is applied. And this particular intervention shown is one where, to mitigate the energy crisis, households are given an amount of income boost, if you like, relative to their energy expenditure. So it's kind of an energy crisis mitigation intervention. And again, if you'd like more information, please contact me or Rob, and we can give you some more information. And lastly, some more information on the wider SIPHER ecosystem related to this research. So firstly, there's a link there to the SIPHER synthetic population at the UK Data Service, my colleagues Nick and Andreas and everyone else. And on the right are 2 papers that are both currently in review with their respective journals. So the local authority level data set, led by my colleague Nick Lomax, and the ward level data set, which I'm leading. So if you're interested in this research, get in touch again and we can keep you up to date on when those papers are published, because there's a lot of information in the papers that may not be anywhere else. And some more information on the resources that are available for everyone that's joined us to explore the data sets. And as I say, please get in touch. But here's a link to the technical report on which both data sets are based. The SIPHER product guides there, data repositories where you can download and visualize the data, and web visualizations where you can't alter the data, but you can look at the data and investigate different areas. And lastly, a paper from a couple of years ago on the previous version of the SIPHER synthetic population. And very lastly, here are screenshots of the web visualizations, and I'll show one of those now, or I'll attempt to. So we have a separate tool for each, so the local authority level and ward level. So if you just give me a second. So can everyone see that? Or can anyone not see it?
No, not at the moment. Yes, now we can.
Okay, good. So this is the local authority level dataset visualization. So here are the variables. Here's the let's take an example. Yeah, so inclusion in decision making. So the metric behind this is the proportion of people voting in local elections. So we can go to a particular area, and I hope you can see the value on your screen. But when you hover over an area, you can see the value. But I'm not going to spend a long time. You can play with these yourself. And here is the. So sorry, I should take a step back. This was constructed by my colleague Rick Colasanti. So thanks, Rick. And I don't know if you're present, but thanks again. And this is the ward level data set visualized at the CDRC website. Again, thanks to my colleague Oliver, who I think is here at UCL. And again, it's a slightly different format, but it's exactly the same outcome. So you can hover over an area and you can see all the values of the indicators. And lastly, for the ward level data set, I produced a Python notebook. So this requires it requires no coding, and it requires just a couple of commands in the command line. So this is tested on Windows and Linux. And this allows you to reproduce some of the. So I'm running this in real time. This allows you to reproduce some of the visualizations that I've showed earlier. So this is the data set. It's kind of in data frame format, and these are being produced on the fly. So these are some area level visualizations of different indicators. So you can specify that yourself. And again, here some IMD comparisons as well. And at the bottom, some local authority to ward level comparisons as well. So links to all of those are at the website, which my other colleague Alison has been furiously updating in the last few days. So at that point, I will flip back to the sorry, just so I can go full screen again. So can everyone see the slide again?
Yep.
How's that?
Perfect.
Okay, so will I pass back to Petra at this point?
Yes, you can. Thank you. Fantastic resources that have been produced. Quite proud to have let this program of work, even if all of you have done all the work. But it's great to see it all come together now. We now have the opportunity for some questions. If you haven't already submitted these, still a chance to do that via the Zoom question and answer tab, and we'll get to as many as time allows in the last sort of 10 minutes or so that we've got. I would briefly like to mention that you and colleagues have today published a new SIPHER blog around this work, around new inclusive economy ward level data set, and a blog around that and how to use it and so on. So visit the SIPHER website to check this out if you're interested. But yeah, there's also, you know, all of the stuff that you've just presented to you there. So if you can stop sharing now, I'll ask you the first question that's coming. Which indicators presented the biggest challenge?
All right, I'll just stop sharing so you don't have to.
Yeah.
How's that?
Stop
sharing.
Yeah, all good.
Okay, thanks. Yes, so each indicator had its quirks and nuances, but I think the most difficult one, just because of the format of the data, was indicator 6b. And I think it's a good example of the difficulties that we experienced. And I think people working in this area probably had very similar experiences. But the metric was the voter turnout rate at local authority at ward level in local elections, and it became clear early on that the data supplied to us by the Electoral Commission had errors relating to the ward codes. So instead, we had to match the wards. So we had to link up the wards to the data by the names instead, which was much more difficult. So that required quite a bit of coding to get it to work. Yeah, that was the most difficult indicator, I think.
I'm not entirely surprised that it was. So the second question here is, I'm interested to know more about the checks and validation you carried out on the final data. And don't be surprised if I do go off camera in a minute.
Okay.
I think the connection isn't entirely stable. I'm still here.
So we had slightly different validation processes for the two data sets. For the first one, it was more of a group effort between me and my colleagues Andreas and Nick. We allocated ourselves a certain number of indicators, and we did the same kind of set of checks. So we did spot checks for all of those, and for the ward level data sets, each indicator, which I did all the processing for. I also did apart from the validation that I've also already showed with the indices of multiple deprivation, for example, in comparison with the local authority level data set, yeah, we did spot checks, and we did a kind of a comprehensive review of all the reference data that we used, like the ward definitions and the spatial data for each ward. So it's all laid out in the papers, which is not very satisfying for guests today. But yeah, if you'd like more information on that, as with everything else, please get in touch. But we had quite a comprehensive checking process for each indicator individually.
was that here? Apologies if I missed this in the presentation, but by less inclusive, do we generally just read poorer rather than more unequal?
Not necessarily, I would say, and please, Andreas or Nick, jump in if you disagree. Well, I should start by saying we didn't explicitly look at the relationship between the cluster membership and household or individual income. So I should say that in advance. So I suppose, in a sense, that would be an interesting piece of research for someone to do if they chose to use our data set. The other aspect, to answer in a different way, I would say, in some cases, no, it was counterintuitive. And again, Andreas, if you're present, please jump in. I would say London, for example, while having higher incomes often than other local authorities and wards outside of London, also saw less favourable values of some of the economic inclusion indicators. So it was kind of counterintuitive, which is why that tended to fall into a cluster of its own, because of the mix of extremes, because of the degree of inequality in some of the London areas. So I think the best answer I could give to that was we didn't look at income explicitly, and the answer is at best yes and no.
I think we actually did at some point, because we were asked that question before. So if I remember correctly, we did have a look, and the inclusive indicators explain a lot, or represent something that is different to merely income or deprivation in an area. So do read it as economic inclusion rather than poverty, because it does explain different things and doesn't entirely correlate either. I mean, it's correlated, but it's not a perfect relationship. And economic inclusion, as defined by the indicators, explains health outcomes, as we've just demonstrated, better than income on its own. Question 4. Are there plans to expand the data set beyond 2019, 2021? This is when you look pained. Or to include additional indicators that could capture new emerging aspects of economic inclusion, such as environmental sustainability?
Well, not explicitly within SIPHER, because we're a bit time limited with SIPHER. It ends in March. But yeah, we've considered the sort of the possibility of updatability, and it is this isn't, again, not very satisfying to guests, but it's we talk about it in the world level paper. In general, yes, it's always possible to update the data set with more recent data, but no, we don't have any specific plans. And the likelihood would be that if we did do an updated version in, say, a couple of years, several of the indicators would have to be tweaked slightly to have different metrics, because at least one of the administrative data sets that we use, which is, I think, the house price data set, which is on the ONS, has been discontinued, for example. So in general, it's always possible, but for some indicators it presents a challenge, and we don't have any concrete plans. However, and Petra will be happy about this, I should mention the Gallant consortium as well, which has specifically looked at environmental indicators, which I've been kind of tangentially involved with. But no plans on that at the moment from the point of view of SIPHER, because we're a little bit time limited.
Who's particularly interested in environmental indicators and how they might be brought together with inclusive economy indicators, can contact me after the webinar, and I can say a little bit more about plans there. So we've run out of time for questions. Sorry if we didn't get to yours. Thank you all for joining us today at today's webinar, and for all the questions. A full recording will be available on the SIPHER website soon, so please keep an eye out on that, and feel free to share it with any colleagues for whom this would be useful. Our first webinar, Public Involvement in Policy Modelling Research, featuring Professor Ella Stewart, is now available online also. In the new year, our programme restarts in February and includes presentations on system science approaches to housing and health, and the evaluation of a complex system science program, learning from the SIPHER Consortium. Full details, as usual, on our SIPHER website. We hope you can join us for these future events. Thank you again, and thank you. Well done, and take care. Have a good day.